Well, she's been an all-star in answering your COVID vaccine questions for days now. So we're going to bring back Monica to tackle a couple more of those. Our senior health correspondent, Monica Robbins, joins us now. And Monica, yesterday on Meet the Press, an infectious disease expert said we should consider just giving people one vaccine dose so more people can get vaccinated. I have heard conflicting reports on this idea. So is this starting to sound like more of a serious consideration now?
Well, Michael Osterholm is an epidemiologist who advised President Biden's transition team on the COVID-19 pandemic and suggested the president should focus on giving as many first doses as possible and delay second doses because at least one dose gives you some protection. Now, he's not the first to suggest this because the UK is delaying second doses as much as 12 weeks to get those in priority groups covered by mid-February. And while the CDC says we can now wait up to 6 weeks between doses, we'll have to wait and see if this is even a viable plan. Now, you might get about 50% protection after one dose, and there is very preliminary research indicating one dose might be effective for those who already had COVID. But Dr. Anthony Fauci warns delaying the second dose might cause those variants we've been talking about to spread even faster. And I think watching what happens in the UK will give us some more clear insight on whether or not this would even work. So no, at this time, it is not an approved protocol, but it doesn't mean they're not paying attention and possibly even considering it, Bets.
Yeah, well, I am very excited to report my dad is scheduled to get his first shot tomorrow. And so we have been waiting for that to go down. So you've been warning seniors about not getting fooled by scammers. My father has been warned. My mother has been warned. Do you have any more tips for folks as they're getting out into lines?
Yeah, I know Tim and Sue. I'll call them myself on this one. But first of all, what everybody needs to remember is make sure you remember specifically all those places that you've registered so you might know who would be calling you to get your appointment scheduled. Now, if somebody calls and says you have to pay for your vaccine or you have to pay to get your appointment or they ask you for credit card or banking information, hang up. Now, you may be asked for your insurance, Medicare, Medicaid information because vaccine providers can charge an administration fee for giving someone the shot. However, that fee will be covered by your insurance, not you. You will not be asked to pay. Now, the scammers will typically be calling you and asking you for your social security number and banking info. That's when you need to hang up. And listen, if you're not sure about all this, tell them you'll bring all the necessary information with you to your vaccination appointment and then deal with the doctor or pharmacist or nurse or whoever's giving you your vaccine directly. That's the safest way to do it, Bets. Don't give any more information over the phone than you don't have to.
Awesome. This is why Tim and Sue refer to you as good people. Thank you, Monica.